All right, let's talk about some potential problems. I'm going to take a quick drink of water. So potential problems. I already alluded to the dairy problem. When we pasteurize dairy, which is most of the dairy involved or most of the dairy available in the grocery store today, when you pasteurize dairy, it actually changes the constituents, the mineral constituents in that dairy and turns them into an inorganic form. So it's not much different than just eating a rock. That inorganic form is not absorbable by the body or recognizable by the body, and it ends up just freely floating and turning into things like kidney stones, gallstones, tartar on your teeth, plaque in your arteries. So when you're using a pasteurized dairy, it also changes the phosphorus calcium balance in the blood. And oftentimes the body has to pull calcium from your own bones in order to balance what this dairy does, because it's actually acting in an acidic way in the body, even though it's alkaline. I know this. These are kind of some confusing concepts. I'm trying to simplify. Basically, pasteurized dairy is worse for you than no dairy at all. So it's better if you don't have any dairy if you're going to use pasteurized dairy. Try to find raw. I know it's not available everywhere, but it is the best way to go if you're going to use a dairy product. The grain problem. Grains are fabulous, right? They're the staff of life. However, we have forgotten how to handle them. Pretty much every society up until the modern today society of about 1950s on has soaked their grains before they use them. Why? It takes longer. Why would you do something that actually takes longer to do? Because what they know is that soaking inactivates something called phytates, which are anti-nutrients on the outside of that grain. That phytate makes minerals and nutrients unavailable to your body. That's in the grain, but also that's eaten along with the grain. So let's say you have a beautiful salad along with a piece of bread that has been made with unsoaked, unfermented, unsprouted grain. Well, that grain is actually going to make it so you're not absorbing nearly the amount of nutrients out of the salad that you ate along with it. So how do we overcome this? We soak our grains. This is easy. You plop it in a bowl, cover it with water, and let it sit overnight. That's simplifying a little bit more of a complex answer, but that's basically it. Every single loaf of bread made prior to about 1950 was made with a natural yeast. Why? Rapid rise yeast wasn't a thing. It wasn't possible. So every single loaf of bread had to be made with a natural yeast process. That natural yeast process slowly soaks and ferments these grains and changes these anti-nutrients. So the nutrients are available to your body. There's been a lot of changes in grains just from a hybridization standpoint as well. Again, this is a long conversation. The short of it is soak your grains, cover them with water before you use them, and use sourdough for truly sourdough fermented breads to avoid the issues with these grains. What Dr. Weston Price found is that these were two of the biggest issues happening, the changes in dairy and the changes in grain that were leading to a lot of cavities. Now, the third is the vegan problem, and a lot of people want to throw a lot of tomatoes at me when I say this, but it's very difficult to get all of those fat-soluble vitamins without eating any animal-sourced products at all. It's almost impossible. So you definitely need to supplement for sure. The other issue is that often a vegan diet is very heavy on grains. Well, if those grains aren't being handled properly, there are going to be a lot of anti-nutrients. So your diet's almost working against your nutrition at that point. So if you are vegan, and some do, my very best friend is, for ethical reasons of her own, and I support and we'll always support that in her. But I'm very careful to tell her, you need to be supplementing and you need to be aware of the grains that you're consuming for this reason. All right, so that's the clean your teeth, feed your body part. Now, this is the part about how in the world can dentistry affect your overall health. And this is the one that we really raise a lot of eyebrows at. There are 4 ones that I talk a lot about: root canals, infection where teeth were removed, or another word for that is bony cavitation, mercury fillings, and poor sleep. All right, let's dive into the root canal issue. Remember, I told you that slide where we talked about enamel is the outside layer. It's the mineral layer that we see. The next layer in is the dentin. There are a mile of tubes. They're nutrient channels, feeder tubes going from the nerve and the blood vessels on the inside all the way to the enamel on the outside. That's what a tooth is made up of. When a root canal is done, what happens is the nerve portion of the tooth, the inside portion of the tooth, is accessed. It's cleaned out, disinfected on the inside of the tooth. The disinfectant of choice is bleach, just so you know. That's what's used to disinfect inside of a root canal. The bleach is supposed to eat away some of the tissue as well as kill the bugs inside of the tooth. So that tooth is disinfected, and then it's filled up with a material called gutta percha. It's a rubber-like material it's from a tree in the Amazon, and it's kind of rubbery, and it seals that we also use as sealer. Dentistry also uses a sealer that kind of glues this gutta percha in place. Now, the concept is great. It really is. The tooth is filled up, the pain goes away, you put a covering on it, a crown, something over top of it, and you still get to keep the tooth in your mouth. You get to smile with it, you get to chew with it, you get to use it, you get to do all these things. It's a great concept. The idea is fabulous. I just wish it worked. The problem is all of those tubes. They're too little. It's impossible to clean all of that mile of tubules inside of every single tooth. So what happens is dead tissue remains in those tubes, but bacteria also does, particularly if the tooth was already infected before the root canal was done. So if you already had an abscess, you already had a swollen face, you already had any of these things, well, that tooth was full of bugs before the root canal was done. So when that happens, we seal it off. Glue, this gutta percha material seals it. It's like backing up a sewer system. Those tubes are full of dead tissue and bugs. And if they're not full of bugs already, they're going to be soon, because dead tissue always attracts bacteria, always attracts bugs. So those tubes are full of dead tissue and bugs. The body's immune system can no longer get there to fight them because we sealed it off. Remember, that's what the root canal procedure did. It removed all the blood vessel and nerve tissue on the inside of the tooth and sealed it. So now the immune system cannot come up through the center of the tooth, through those vessels, and get out and kill those bugs. It cannot keep the tooth healthy anymore. We've backed up the sewer system. However, those bacteria, they start to eat the dead tissue. They start to flourish, and they start to dump all their toxins outside of the tooth. So it starts to eat away the bone surrounding the tooth itself. We can see these on a dental CT scan. If they're large enough, we can see them on a traditional dental x-ray. We can't always see them though, and I believe I have a picture to show you here in a minute about this. Over 95% of root canals harbor infection because of just what I told you right now. Not because anyone did anything wrong, not because they did the procedure incorrectly. It really isn't a fault of the practitioner at all. It's a fault of the procedure and the concept and the fact that we forgot that these teeth are full of tubes, and those tubes will harbor bacteria as well as dead tissue. So over 95% harbor infection. Why only 95%? Why the other 5%? Well, there are some bodies that the tooth was not infected. It was a trauma situation, and it hasn't infected yet, but it will at one point. Over 35% of the population has at least one root canal. So that means at least 35% of you listening have something in your mouth that could be causing or contributing to your chronic disease situation. This slide I need to update. It's actually not 20 to 25 million root canals. It's 30 to 35 million root canals are performed in the United States per year. That means 30 to 35 million more people per year have the potential for an infection that's low-grade, chronic, and affecting their health. That means 35% of the population at minimum has an asymptomatic dental infection. What do I mean by asymptomatic? This doesn't hurt. The nerve's gone. Sometimes it does hurt. So that's not a true statement across the board. Sometimes this does hurt. People will describe it often as an aching, like it just never quite felt right. That's how they describe it. Or ghost pain. Just didn't never feel quite right even after the root canal. It's supposed to not feel anything, but it still does. Some people explain it like that. Others have no sensation whatsoever because the nerve's gone, remember? And bone is actually very lightly innervated, meaning there's not a lot of nervous system in the bone. So as that bone is getting eaten away by all those bacterial toxins, it doesn't really hurt. I have found holes in people's jawbone the size of a quarter, and they had no idea it was there. So how do we find it? I find it on a cone beam CT scan. Now, this is a picture. This is an old cone beam CT scan. They're so much better now, but I always have to use this one because this was the first one that woke me up to this situation. The x-ray on the left is a typical dental x-ray. I'll always remember this patient. I remember the room she was sitting in my office. I remember what she looks like. She complained of pain on a root canal on the upper left. And she said exactly what I explained. It just has never quite felt right. So I took a traditional dental x-ray, which is what we're looking at over here on the left. It looks fine. If you were to take this to any dentist anywhere and ask them, how does this root canal look? They're going to say, that looks fine. It's clinically acceptable. It's fine. Well, I had just gotten a CT scanner, the CT scan machine in my office, and I said, let's do a CT scan. I'm just curious. I want to find out what we're going to see on this. So I took a CT scan, and what I found, I don't know if you can see my cursor right here. This is the tooth that I took an x-ray of that has a root canal. This whole area right here is destroyed bone. This one's about the size of a nickel. The entire area of bone over not only the root canal tooth, but the one next to it was completely destroyed. I couldn't see it. I just couldn't see it. We cannot see it on traditional x-rays. So cone beam CT scans, 50% better at finding dental infection. I disagree with my own slide. I think it's probably about 98% better at finding dental infection. I can see everything on a CT scan. It's 3D. I can turn you upside down. I can turn you inside out. I can go down, up and down your tooth in just tiny little slices. I can see everything. I can see if there were nerve canals that were missed. I can see everything on a CT scan. This is why this is such an epidemic. We can't see them. We don't know that it's going on. Every single day, people ask me, why did my dentist not tell me about this? They couldn't see it. It's not that they're doing anything wrong. They just simply couldn't see it. You have to get a cone beam CT scan. This is a dental specific CT scan. I'm going to be saying this over and over and over again. All right. The second one that we need to talk about is a bony cavitation. Now, bony cavitations are areas in the bone that didn't heal after a tooth was removed. Interesting. Which teeth are most frequently removed? Wisdom teeth. How many of you have had your wisdom teeth removed? Probably 80 to 90% of you have had wisdom teeth removed. When a tooth is removed, a few things have to happen correctly. The ligament that's surrounding the tooth has to be intentionally removed, and it doesn't just come out naturally with the tooth. It has to intentionally be removed. All the little bone pieces, all the little tooth chips, everything has to be intentionally removed. If anything is left behind, it acts like a sliver in the bone. And if you get a sliver in your finger, it will swell up. The body tries to push it out, but it won't heal as long as that's in the tissue. The same thing happens in the bone. If that ligament, if that tooth fragment, bone fragment, whatever is left in the bone, the body can't heal. It will form kind of the same as it does on the sliver. It'll form a cyst structure around whatever that irritant is, and it will not allow bone to heal. Bone cannot heal inside of that. Well, then that tissue will die. The ligament, everything dies inside of this cyst, and you have a dead zone in the bone that's unhealed. We talked about this. Dead tissue always attracts bugs. So microbes of all varieties, we biopsy these and we find bacteria, virus, fungus, parasites, the craziest things you could ever imagine in these bony areas. What do we do about it? We actually go back in and clean these out again. This is hugely related to inflammation. So if you have arthritis, if you have adrenal or energy issues, if you have brain fog, if you have low thyroid, if you have Hashimoto's, if you have autoimmune disease, there is such a correlation between these areas and all those things that I just listed, because this leaves your body in a constantly inflamed state. If your body is constantly inflamed, the immune system is constantly working. And when it's constantly working, it gets confused and overwhelmed and tired out and worn out. And you use up all of your stress dealing with hormones because you're dealing with this nonstop. So we see so many autoimmune diseases based or related to areas where you had a tooth removed 3 decades ago and had no idea that there's a chronic long-term infection there. How do we find these? Cone beam CT scan. It's the only way. And a dentist that knows what they're looking for when looking at these. What's in these areas? These are actual biopsies from patients. These are things, parvovirus, all sorts of strep, cytomegalovirus. Over here, Campylobacter, really bad, Entamoeba parasites. These are actual biopsies that we've done in these areas, and these are bad bugs living in these holes.